There's still a stigma surrounding mental health and substance use disorders. And really, substance use disorders can affect anybody. It's regardless of race, gender, age, income, or locations.
And we're touching real people, and real people in a longitudinal way. And that's pretty impactful.
Welcome. I love to open up these podcasts with more of a personal question. Melissa, I'll start off with you. What do you like to do in your spare time? What do you like to do to unplug? That just, take the physician hat off and just be you. What does that look like for you?
That's a great question. And I hope everybody gets some spare time. In mine, I really like to spend my time with family and friends and do some traveling. I love to see different areas abroad and within the United States.
Yeah, there's nothing like just kind of decompressing and getting lost in another person's culture, different state, whatever the case may be. Demetrios?
Yeah, well, Josh, thanks for asking. I really like to fix things. I get the opportunity, with cars, with my sons, with my daughters, with my son-in-law, just to, work on things, whether it's a house, a car, solving a problem that we've created for ourselves sometimes, and getting ourselves out of the bind.
Nice. Just kind of getting lost and trying to figure it out, right? Whatever that looks like for you. So thank you very much for sharing. I know you both obviously work at Highmark, and I would love to know at a pretty high level, Melissa, I'll start off with you. What is the overall mission of Highmark? What does that mean to you, and how can you explain that to our listeners and viewers?
So as a psychiatrist and working with Highmark, Highmark's mission is really to provide access to affordable and quality healthcare to the people and communities that we serve. And we are committed to providing innovative solutions that meet the needs of our members and our customers to improve mental health and well-being.
Demetrios, your words?
Yeah, so my words is sort of similar to what Dr. Perry said. We have membership, they have families, and we're trying to get them access to their available benefits. And with that access, they're able to live a more complete life, free of, whatever problems, illness, ailments may cause them.
And Demetrios, why don't I stay with you for a few more moments? Can you drill down a little bit more in terms of what your role is at Highmark? What does that look like on a daily basis?
Yeah, so my role is I'm involved with the enterprise behavioral health team. And what I do on a daily basis is look at sort of how behavioral health impacts our membership, and how our benefits, are available to those members, how those benefits are structured. And because Highmark is also an integrated sort of payer as well as a provider as well as a payer, looking at how our health system partners work together in the mental health substance use disorder space, with the idea that a person who's free of mental health substance use disorder kind of symptoms, ailments, can be a lot healthier, even with other chronic physical health conditions.
Dr. Perry?
I'm fortunate as a child and adolescent psychiatrist, as well as an adult psychiatrist, to be able to work with the enterprise behavioral health side with Demetrios and the team, and also with the utilization management side. So working with the utilization managers, working with the care managers, the nursing staff, and really clinical operations to help with our members, to help with member education, and analytics as well.
One of the things that we've heard over and over and over again is this opioid crisis that we're currently dealing with. It feels like that it's in every part of the country. I would love to know, how is Highmark working to improve care for patients that struggle with substance abuse?
So I could say there, as you mentioned, millions of Americans in the United States are struggling with substance use disorders, including opioid use disorders. I'm really proud to be part of the Highmark team that helps with Demetrios and his team as well to work on helping patients, helping members with prevention, mitigation, and treatment. And really one of those first steps that is needed everywhere is to decrease stigma. There's still a stigma surrounding mental health and substance use disorders. And really, substance use disorders can affect anybody. It's regardless of race, gender, age, income, or location. So that's really one of the primary keys.
Demetrius, can you speak to any programs or partnerships that Highmark has in this area?
Yeah, as Dr. Perry mentioned, there's sort of a three prong sort of, let's try to avoid building any new issues. And so with that, we have a partnership with Axial Wayspring, and what they do for us is they help profile our prescribers. And in profiling our prescribers, we're looking for those risk variables, which prescribers may be generating some additional risk that might be necessary. They then reach out to those providers, those prescribers, and try to have those conversations. In essence, some clinical detailing with pharmacist to prescriber to try to identify and how to identify ways to mitigate that risk. The other prong is, where we have members who clearly have pain drivers and they need to be on well-managed, pain medication, knowing that it creates risk. We try to do that at the levels possible without creating additional risk and additional problems. And then where we have members that have treatment needs, we try to lower those barriers to care, such as where we're opting to have prior authorization or concurrent review, and where we opt not to, in order to reduce those barriers to care, as well as we've also in our third year of a value-based reimbursement program that's focused on the residential treatment and withdrawal management models of care.
If we can be even more granular, I would love to know from you, maybe Dr. Perry, what are some of the critical challenges that we all face as a society when it comes to care delivery, and in particular when it comes to substance use? Can you speak to that?
Sure. And to go along, I think really that number one is that stigma that's still associated to it. So working on decreasing that stigma, as well as there's a lack of access to affordable and quality treatment, either treatment facilities or medication assisted treatment, sometimes known as MAT, which is a proven and effective treatment for opioid use disorder. So having access to that is really imperative. Also making sure that it's affordable, making sure that there's care coordination between providers for continuity of care.
Demetrius, do you want to speak to this as well?
Yeah, I think it's critical. I mean, once again, to improve the literacy of our membership, so that they have an idea of where care is available and at what level of care they may be best served. And with that, trying to avoid some of there's a lot of actors out there, bad actors who are occupying the space, and with that providing information that may not serve our membership well. And so we're constantly trying to counter sort of poor information, incomplete information, with sort of factual information, as well as what their benefits may be able to take care of with them. They may not need to leave their community and go 3,000 miles to, and ride horses on a beach in order to enter recovery for a substance use disorder. They could probably do it at home, do it in their community, with the supports necessary to be successful.
Demetrius, I've heard that you use this terminology called the digital front door. Can you elaborate on that?
Well, I mean, so for us, the digital front door is an attempt to sort of add, this an additional access point, so members can access potential benefits, and through digitally interacting, and with that, because there is stigma present, they can do it a little more privately. They can assess their symptoms, assess their needs. If indicated and if willing, they can interact with individuals and set up chats, et cetera, in order to get access and be linked to care, or be linked to Highmark has licensed behavioral health clinicians as case managers that can help them further sort of identify, stratify their need, and be linked to the right level of care for their need.
Dr. Perry, can you please speak to the importance of healthcare literacy, especially with mental health and substance use?
Absolutely. Health literacy is so important, and it's the ability to understand and use health information to make informed decisions about your health, about your treatments. And it's especially important in mental health and substance use disorder treatment. Sometimes it's difficult to understand the signs and symptoms, the diagnosis, and the treatment options available. So we at Highmark really like to help where we can provide clear and concise information with our care managers, using plain language, avoiding medical jargon, and really offering support and assistance to everybody who needs help understanding any health information. And we encourage our members to talk to their providers and to ask questions if they have them.
Demetrios, did you want to add anything to that?
Yeah, so as part of that, and specific to mental health and substance use disorder, Highmark has partnered with Spring Health to be at that digital front door for mental health well-being purposes. This will allow our membership to access 24/7 questions. I really come from the perspective on the physical health side. If you step off the curb and twist your knee, you've got an idea of what to do. You've got an idea of how bad it should get before you put your hand up, ask for care. And you even have things that you would do in terms of ice it, elevate, things like that. In mental health and substance use disorder, that's not well known. We don't have this sort of common understanding. And we also understand that it's not uncommon for people to be symptomatic for 8 to 10 years before they get connected to good care. So part of this approach for us is to add some additional avenues for our membership to practice mental well-being, gain access to ask questions, information, and to be guided, if necessary, to the right level of care, either through Spring Health and the additional providers they've brought to our network, or the rest of our Highmark network of providers.
Mm. Dr. Perry, you mentioned that you are a child and adolescent psychiatrist. How do you apply those skills and that academic learning at Highmark in your current role?
I think as a psychiatrist working with children, adolescents, and families, it really helps open my eyes working with members on some of the difficulties that there can be with access to care and with treatment being both the therapy and medication treatment. And so the ability with Highmark to help improve that access to care and to really use active listening and to help understand what the problem is and how can we make movements in the right direction.
And a question for you both. I'll start with you, Dr. Perry. Any real life examples in your work that you can provide our listeners and viewers?
I think one of the best things in the work is following up with some of our nurses and care managers and hearing about success stories about a family that was having such trouble finding a mental health provider for their kiddo, their child, and working with Highmark and finding that access, and to hear that the family and the patient, the child, is doing better is really great.
Yeah. Demetrios?
Yeah, well, so I'm sort of in my 20th year as in managed care, and before that, as a clinician, focusing primarily on families. This idea of a family struggling when symptoms are present, and being able to see the relief that is available. When a family member is able to have their symptoms sort of relieved, enter recovery. And we have a lot of evidence-based care, and where we're able to sort of promote or even provoke use of evidence-based care. The outcomes can be, quite remarkable, and we're touching real people, and real people in a longitudinal way, and that's pretty impactful.
You know this technology, but specifically AI, is a part of every single conversation that we're having as human beings. And I would love to unpack a little bit from each of you. What is the biggest opportunity for technology in healthcare, Dr. Perry?
I think the biggest opportunity for technology in care is really that digital front door. So having access to coaching or having access to personalized provider matching. So somebody that specializes in post-traumatic stress disorder and can provide the treatment for that. And really having that personalized medicine as being a core component to treatment.
Demetrios?
Yeah, so I think some of the promise for AI is really ingesting the vast data that's available. And with that, being able to sort of identify members that have need sooner and not waiting for them to have an incredible struggle or reach a point of frustration before they, get activated to seek care. The other, and more specific to AI, is we're also testing out some technology related to digital phenotyping, where we're looking at both sort of vocal and semantic components of the verbal interactions that we have with our members, and testing that. Now, just because it's there doesn't mean it's useful. And so we're looking, at that sort of potential utility of, what's possible with that, and does it provide value? That's the other piece of it. Just because you can do it doesn't mean you should. Is it meaningful?
So exciting. So exciting.
Oh, it's very.
Indeed. My last question for both of you, Dr. Perry, I'll start off with you, and that is, the next big thing in health, in your own words, is?
So there are so many possibilities for the next big thing in health, with new technology and the world ever evolving. But my big hope and for the next big thing in health is to break that barrier fully for the stigma of mental health and substance use disorder treatment. I'm hoping that there's more education surrounding mental health, mental well-being, starting at a younger age. So starting even with our children, adolescents, so that they can recognize emotions, feel their emotions, and manage their emotions, teaching those coping skills at a young age.
Demetrios?
Yeah, so for me, the next big thing in health is really that next member that has the need, and being able to link them to care. We have a lot of amazing things. That person with diabetes who has their untreated depression getting in the way of being successful at completely treating and being stable in their diabetes, and avoiding the sort of the path that is well established if you're not well controlled. The same thing with the anxiety that can come along with congestive heart failure. Living your best life, the most complete life you can, in the face of chronic physical illness, in the face of mental health or substance use disorder, and finding that relief.
Well, thank you very much.
Thank you.